Hello, everyone. Hello, Scott Heroes, IFMSAians. Today, we are finally finishing our World Immunization Week of 2019 with a surprise webinar for all of you. And we have two wonderful speakers here with us, as well as Mia, our development assistant, who was in charge of preparing this whole week. So we hope that you enjoy the webinar very much, that you learn a lot, especially about vaccinations and vaccine hesitancy. And feel free to send your questions in the chat on YouTube or to Omnia, and we will be taking the questions at the end of the webinar. So without further ado, I would like to ask our speakers for a short introduction. Mika.
Hello, hi. My name is Mika. I'm an infectious diseases and medical virology specialist. I'm also a clinician scientist currently working at the University of St. Andrews. So I'm doing research on TB and HIV. I'm also an IFMSA alumni, so I worked as a SCORA liaison officer in between 2008 2009. And worked in IFMSA overall about 6 years. So I'm glad and excited to be joining you on this webinar. So it's my first experience. So hopefully it will be very useful for you. And my talk will be basically covering the history of vaccines and I guess the current situation of vaccination and vaccine coverage in Europe, in the US, and general all around the world. And yes, that's all.
Thank you very much, Mika. And next we have Kalin. Okay, Kalin might be joining us a little bit later, so then we will start with Muga's part about vaccines. Muga, the mic is yours.
Perfect, thank you. So partially the reason I'm joining you guys is because IFMSA, we recently created a collaboration between Trainee Association of ESCMID. ESCMID is the European Society of Clinical Microbiology and Infectious Diseases. So it's one of the largest societies in the field of infectious diseases. So it's very interesting and exciting to see SCOF participants interested in this basically field. I guess I'm going to go over in general the impact of vaccination. I guess one of the brightest chapters in history of science is the impact of vaccines on human longevity and health. So this is a very nice paper. You might want to read it, but basically it explains the vaccination, the impact of vaccination on the health of world's people is hard to exaggerate. You know, it's with the exception of safe water, nothing else, not even antibiotics, has had such a major impact on the reduction of mortality and morbidity and on population growth. It's been over 300 years since the first vaccine was discovered. And I'll go over what has happened and where we are at the moment in 2019. So according to WHO estimates, vaccines prevent more than 2.5 million child deaths globally. However, around 169 million children did not receive their first dose of measles vaccine between 2010 and 2017. And on average, it's 21 million a year. So this is according to UNICEF report. It's quite sad. Measles cases, I will touch base on that, have continued to climb into 2019, as you know. Preliminary data from 2019 shows that reported cases rose by 300% in the first 3 months of 2019. So it's quite alarming and it's quite worrying. But we'll come to that. What I want to give you a little bit sense of what has happened over the last 300 years. So the beginning of vaccination actually goes back hundreds of years. The earliest hints of practice of inoculation for smallpox was performed in China. It's from in the 10th century. According to Voltaire, the Turks derived their use of inoculation to neighboring countries like in Russia, Georgia, and then importation to the West actually happened probably, or according to the history books and some of the Wikipedia records, this lady, who was the wife of the consulate to the United Kingdom, and she saw mothers inoculating basically cowpox to their children. So she apparently brought that to the UK. And this was the first time that the Europe was, interested in this type of inoculation. And what happened? I mean, in terms of timeline, vaccines have a history that started late in the 18th century. Live cowpox inoculation, and then Louis Pasteur was inactivating bacteria with different chemicals and heat. And then he was experimenting attenuation. And then we know that in the late 19th century, vaccines could be developed in the lab. And then in the 20th century, it became possible to develop vaccines based on immunological markers. So antibodies showing immunity to certain certain bacteria. And then toxin production was found to be responsible for disease, like, for example, diphtheria and tetanus vaccine. Those are antitoxin vaccines. And then revolution post World War II was basically people were able to culture viruses. So this was a huge revolution in vaccinology, because now people were able to research on the viruses, and that's the time that change everything, because now when you look at the vaccines, most of the vaccines are on viral infections. And in the 21st century, I think molecular biology permit the development that was not possible before. So first polio vaccine, and then pneumococcal polysaccharide vaccine, hepatitis B vaccine, which was plasma derived, and then again, like hepatitis B vaccine has started to be used with the molecular biology. And then since 2000, vaccine research and development has changed greatly, from an empirical approach to one that's rational, supported by both basic and applied sciences. So we have many other vaccines: meningococcal vaccine, rotavirus vaccine, zoster vaccine, dengue vaccine. So these are some of the examples. So one thing that I want to cover, I'm sure you must be aware of this, is the herd immunity and basic reproduction number and herd immunity thresholds. So I guess as physicians and medical students, it's important to understand this. So to give you kind of an idea, what that means is, for example, when we look at R0 for measles, it's 12 to 18, which means that basically one person can infect 12 to 18 people if they're susceptible. And when we look at the herd immunity threshold, which means that you need to vaccinate almost up to 95% of population to maintain that herd immunity, which means that if everyone is vaccinated in the population, then the infection will not transmit, even in patients who are not immunized. So I guess as you can see, are 0 compared to other infections listed on that table. Measles is a very highly contagious cause of infection, especially in young children, and it's transmitted with respiratory droplets and particle aerosols, and exposed people who are not immune have up to 90% chance of contracting the disease. So it's quite an infectious virus. So this is kind of herd immunity. I really like this figure. Basically, it means that this type of immunity forms an indirect protection from infections when a large percentage of population has become immune to an infection. So as you can see in the last image, when most of the population gets immunized, spread of contagious disease is contained within the population. And just want to talk about a little bit about measles. I think this will be a nice kind of transition to Colleen's talk about vaccine hesitancy. So as you can see, I mean, these are some data coming from UK. When the measles vaccine was introduced, as you can see with the red line, the notification of measles cases gone down significantly with the vaccine introduction. But what happened is that over the last maybe 20 years, we started to see more outbreaks, and over the last 5 years, I think it's just becoming more maintained infection now in Europe, at least. So I guess to give a little bit background about measles, most people with measles recover without problems after 1 week of illness. However, measles is no means a trivial disease. Before widespread vaccination, the virus caused 2 million deaths globally, because it mainly affects young children and also immunosuppressed people. So, and even today, it remains the leading cause of vaccine-preventable illness, and it basically causes deaths among 100,000 people a year. So, because measles, although it's self-limiting, can basically cause complications. So mainly secondary infections. It could be measles-induced immunosuppression, diarrhea, otitis media, severe pneumonia. I think most of the cases we see in a hospital is either neurological complications or severe pneumonia that's requiring even intensive care management and intubation. And also, as you know, neurological complications such as acute disseminated encephalomyelitis, those are very rare, but I mean, obviously in young children, this is one of the risks. When we look at Europe, this is ECDC data showing measles vaccine coverage. As you can see, what we want for measles coverage is more than 95% of the population to be vaccinated. And as you can see, there are very few countries which was painted in blue. So it's quite worrying. This was from 2017, although this report was produced in 2019. And when we look at the current situation in terms of notification rates, you can see that most of the countries are reporting on a regular basis new measles and outbreaks. So the redder the country is, the higher the notification rates. And I mean, as you can see, measles affect all age groups, but usually 1 to 4 year old children, young adults, those are the population really high risk. And when we look at the measles cases in the US, So this basically shows the number of reported cases through to 2019. Basically in 2000, actually not long time ago, United States achieved a historic public health goal. So they basically eliminated measles, which is defined by not reporting any case or transmission for more than 12 months. However, this achievement was very short-lived, and localized measles outbreaks have recently been triggered by travel-related infections and also subsequent spread through under-vaccinated subpopulations. So it's quite worrying, as you can see. And similarly, in the world, when we look at overall world reports, so this was actually released by WHO just a few days ago as part of World Immunization Week. As you can see, most of the countries are darker red, which means that they have a rate over 50 per million, which is quite worrying. And as you can see, these are reported cases, which means the actual numbers, potentially will be higher than those reported. And in total, just to give you a bit of a rough idea how bad it is compared to 2018. So in 2019, 170 countries reported 112,000 measles cases. And last year, around this time, it was 28,000. So which means that it's almost 300% increase. And in the WHO African region, it's been recorded a 700% increase. In the Americas, it's 60% increase, and European region reported 300% increase. So this is, I don't know how can I emphasize this, but it's very, very worrying. And it's, measles is a public health problem with a clear scientific solution. We have a very, very good vaccine. And measles vaccination up until now has prevented an estimated 20 million deaths worldwide since 2000. And despite this, scientific evidence, global elimination goals have not been met. And unfortunately, there's this was basically in 2017. I showed you 2019 estimates, but there's like 300% increase in the number of measles cases reported globally. And WHO reported increasing measles cases, and a couple of countries which actually previously eliminated measles, now having this large-scale epidemic, and endemic measles transmission is now re-established in, for example, Venezuela. In Europe, number of reported cases in 2018, and I showed you 2019, and it's likely becoming an endemic, region, for example, European region, because of this ongoing epidemic. And I guess like the next step is, and what can the physicians and medical students do? And I guess like this will be a really nice transition to Colleen's talk, hopefully, because she will cover vaccine hesitancy. But I'm happy to take any questions at this point.
Thank you so much for your presentation. Now we have Dr. Khalid. You may now start.
Sorry about that. Was muting my microphone and trying to share my screen with you. And I'm not sure I am actually sharing my screen, but do let me know if you can see it.
Not yet.
Not yet. Let's try that again. I do have beautiful slides. Or not so beautiful.
We want to see them, but yeah, it's not yet. Yeah, yes.
Yep. Perfect. All right. So thank you so much for inviting me to participate in your webinar for World Immunization Week. And thank you, Mika, for the really nice transition. So I'm going to talk to you today about vaccine hesitancy and how you as medical students and future doctors can actually build trust of your patients and the community in vaccinations. So many of those slides are actually adapted from a training module from the World Health Organization that are actually quite good. So I decided to actually go ahead and use those. So first of all, we definitely should start by talking about what is vaccine hesitancy. And it is not to be confused with the anti-vaccination movements, or what we call in lay terms anti-vaxxers. And those anti-vaxxers tend to be the very loud voices on social media, etc. But they are not really the vaccine hesitant folks. If you look at the slide in front of you, you see the red refuse all type of attitude, and this is usually the anti-vaxxers, and vaccine hesitancy is that continuum in between. So anywhere in between, just being accepting to all types of vaccinations, all the way when starting to be unsure about whether I want all the vaccines. If you push me, maybe I'll take them, but I'm not necessarily convinced. Sometimes some people would like to delay things for their children, want to be able to choose which vaccinations to give, which not. And then that spectrum continues to parents and people who refuse vaccinations, but they are not necessarily sure why they do that, or they're not really very well set on their ideas just yet. So putting it in a nice sentence, so a delay in acceptance, refusal of vaccines, despite availability of vaccination services. And it's something that is really, really important. So sometimes when we look at vaccination rates, we tend to look at certain countries, particularly low and middle income countries, and say, oh, the rates of vaccinations are really low, and there must be a problem in acceptability of vaccines and confidence in vaccines. In reality, access may be an issue. As we all know, that is an issue in many things in medicine, and certainly vaccines are not an exception. So if the vaccines are available and people have this uncertainty about them, then this is when we're talking about vaccine hesitancy. This is nothing that you can actually quantify on a global level and say, this is what vaccine hesitancy is everywhere around the world, and this is what we're going to do to address that. So it's very, very variable from where you are geographically, and not even just on a country level, but more so across different socioeconomic demographics, across